Hey everyone, Daniela here from Addo Aesthetics, and thank you for joining us for your weekly dose of inspiration, education, and encouragement. I know you guys are as excited as I am because today I have the one and only Dr. Sandra Lee. You guys know her as Dr. Pimple Popper, joining us to answer the questions that you submitted in the Estheticians Connect Facebook group. So, Dr. Lee, thank you so much for being here.
Thank you very much for having me. This is really nice. So I appreciate it. And hi to all you estheticians out there. Nice to meet you.
So in our among estheticians, you are like an A-list celebrity. I mean, in our in our Facebook group, your
Mhm.
videos come up every week, if not multiple times in a week. Everyone is just like so fascinated with what you're doing. So how did extractions and cyst removal become your specialty?
Uh, by chance, really. I mean, it really kind of turned up this way. I would have to say it's just because I decided to sort of show my world a little bit on social media, mainly Instagram, actually, it started. And when I was posting, I didn't know that pimple popping or extractions would be that interesting to so many people. And so I was posting various other things that are just as interesting to me. But then I noticed that I would get a little uptick in people who liked it or paid attention to it or shared it when I showed an extraction video. So then I just noticed, okay, let's post another one and see what happens. And then I noticed the same thing. So that's really kind of where it started. And it all really started on Instagram.
So is that kind of how it led to your YouTube channel is how I think most people see you now. I
Right.
mean, you have over 1.5 million subscribers, which is impressive. And so was that you kind of it evolved naturally from the Instagram page or was
Um,
as part of your
yeah, so,
marketing
so
plan
what
or?
happened? Well, what happened was that so I've had this a YouTube channel. I had it already for about 4 or 5 years or so before this. I think it was 2010 I started it.
Hmm.
So 4 years, and it was mainly to post. It was actually just solely to post my TV appearances. I do some work for the Doctor's TV show as a guest
Okay.
dermatologist and some other, news stations and things like that. So I was mainly posting my videos there just to show, for people to see. And but at this point, when I started Instagram about a year and a half or a year and 3/4 ago, I started posting some things on Instagram. I decided to post a full video, because at that point Instagram was only 15 seconds.
Hmm.
So I posted a full video on YouTube, and it again got a lot of attention. And that's when I started to look around YouTube a little bit and realize that there were other people who were posting things like this, and they would get a lot of attention. Like I would see the comments and people were really into these sorts of videos. And then what happened is at one point in my comment section in my one of my YouTube videos, somebody said you might want to check out Reddit popping. Have you ever heard of that
No,
before?
I
Reddit
haven't.
popping?
I
So
haven't.
I had not ever been on Reddit. I didn't really know what Reddit was, but I had heard of it before.
Hmm.
So I went on Reddit. Reddit is it's called the front page of the internet. It's essentially where a lot of like viral videos come from or whatnot, where people post on there and then you anonymously can comment or upvote videos, and then they become more important, in the whole. That's how their whole algorithm sort of works on their website.
Okay.
But they have groups of people, like people who like to post funny photos or photos of their kids or cute animals or something like that. Well, there's a whole Reddit or a whole group of people, and it's called popping. And it's just people who post popping videos. People that literally just find them on the internet, or they might see someone with a cyst and they decide to film it and they post it for others to watch. And this group has like 40,000 members. I mean, there's a lot of people that were on this. I had no idea. So I kind of happened upon this subculture of people who I realized loved this and shared it with each other. And it was sort of like a private thing. Like people didn't really talk about it. And
Because you don't want to tell everyone you're
they
obsessed
didn't
with
want to.
watching cyst
Yeah, they
videos
didn't
or
want to
pimple
see.
pop.
Yeah, and most of these videos are, well, essentially almost all of them are like amateur videos, in
Hmm.
terms of it's at that person's house with no gloves, it's your brother or your wife popping it, and there's beer cans, people are often drunk, or, there's
Oh,
just,
yeah.
using paper towels to dab at things. And so I realized, well, wait a minute, I have access to these and I'm doing it in a sterile, clean, calm environment, I mean, I can see why maybe they might be interested in this. So I thought of the name Dr. Pimple Popper, and I just said I'll post some videos here or I'll tag them here. And yeah, that's where I kind of learned that this was a thing, and that they got very excited when they first saw me posting because they realized that I was the actual person. You know, normally it's anonymous, whoever posts that. You don't really know who that person is, but they realized
Mm-hmm.
that I was the actual doctor. So they really kind of helped to um, teach me like what people liked too. So I started to realize that this is a thing, and then I started to understand it too. That people actually, it's very cleansing, it's very satisfying to a lot of people, and I think that's also part of why people go into the esthetician business. You know, I think
Oh yeah.
that that's part of it, that they like to do that sort of thing. I don't know if there are any estheticians or if there are many that hate extractions. I
I
would
don't
think
think they are. They
most of
all
them
we
like
all
it.
love it. We all love
Yeah, I
it.
couldn't be in that business. So that's really kind of where it started, and then it just became huge. I mean, what happened is I think BuzzFeed picked it up a few months, like about 4 or 5 months in, and that's when it got really big.
Wow.
And yeah, since then it hasn't been 2 years yet, and we had like literally I had like 5,000 subscribers at that point, or maybe 10,000 or so, and now we have almost 1.7 million, I
Oh
think,
wow.
on YouTube. There's about we're at 1.9 million on Instagram,
Wow.
and yeah, and the views, we have like 750 million views on YouTube. So it's quite amazing. I just think it's something that people feel good about, really, in general. It makes them feel good, and it's a happy thing, and people aren't embarrassed about it so much anymore. I think they
Satisfying.
found their people, and they're like happy that they can talk about it and share it and enjoy it together, you know?
And you're their leader.
Yeah, it's funny. Yeah. I feel like if you watch Game of Thrones, I in the beginning I really felt like I was Daenerys, with these the group of like the army of the Unsullied behind me, because it was like these people who would defend me no matter what.
Oh
Just
yeah.
because I was like the queen. So it's really kind of cool. It's very
So tell me now what your patient selection process is like. Do they kind of categorize them as they come in with cyst or anything? And do you have like a specific type of extraction or cyst that you are like, yes, they're going to the top of the
sure.
list?
Yes. I still see people as they come in my office, and there are still people who come in who don't know anything about this, but there are equally people who come from far away now. I mean, they travel hours by plane, by car, by bus to see us, which is incredible and very flattering. But it doesn't mean necessarily that they're going to have something amazing. I probably see more cysts. I certainly see more cysts and lipomas than I've ever seen in my entire career. And I wasn't really looking for them before. It's not something that I really look for. Blackheads and things like that, I mean, we will get some from outside people, but I would have to say the best blackheads are usually the elderly patients who have no idea that I have a YouTube channel. So because they don't really watch, they're not
Yeah.
on the internet. So you still want those openings for them to be able to make their appointments, and those are the people I really see a lot of, because I'm a dermatologist, but I'm more of a surgical dermatologist. So I remove a lot of skin cancers and things like that, surgeries, and so those are usually older patients who tend to have the big, amazing blackheads. Um, so in terms of patient selection, I mean, I don't love abscesses. I don't love like the big, huge cysts, but I'll do them, and I know that there are people who enjoy them, enjoy watching them, certainly, and it's interesting, and I think it's fascinating to people that you have this thing growing on you, and
Yeah.
it's normal, and a lot of people have it actually. It's just that's part of it. I think that people are just they're so entranced, or they're so fascinated by the fact that these things grow on us, and they're not life threatening. But of course, the things that I look for are really, I love my elderly patients. They're just so wonderful. They have so much knowledge to share with all of us.
Mm.
Just like it's sort of like you're spending time, a half an hour with somebody, and maybe sometimes people don't speak at all, while you're providing them service. But for us, we do interact with them. I want to speak with them mainly because I want to make sure they're okay. But you just have to make small talk, and so you get to learn a lot about people. So my favorite patients are certainly, the ideal person is somebody with fantastic blackheads, that are, because they're never one and the same. You never know what to expect is going to come out when you start an extraction, but that are older and they have so many interesting stories. They have like a very wonderful personality. That's really ideal. So it's both of those things. It's not necessarily just the extraction. It is the whole package. It's very. I've always been attracted to like stories on television of human nature, like so the fact that you kind of learn about somebody and about their story, but you don't really know who they are while you're enjoying watching extractions is like
I
best
think
thing ever.
I think it's Jim Rohn. Or no, it's Bill Nye, the science guy. He said every single person you meet will know something that you don't know. And I love that because we all have something to share with one another and give to one another. I think that's what you're kind of
Yeah,
getting at right
it's
there.
trying to show that these are people that I would never speak to normally because I don't know them. I don't have friends that know them. There's somebody who's standing in line in front of you at the grocery store, or or at the DMV or whatnot, and you would never really speak to them. And now you're kind of forced to make a little, or somewhat forced to make a little friendly conversation with them, and you find out wonderful things about people.
Yeah, that's really beautiful.
It is.
So, in your practice, what's the kind of, do you have nurses or medical assistants or estheticians? Who's assisting you
Um,
throughout this?
so I think it's different according to the part of the country that you live in. Just like I think esthetician and the rules apply differently
Oh, right.
for estheticians in different parts of the country. It just depends because certain areas of certain states, a nurse is allowed to do certain things. A medical assistant is allowed to do certain things in one state versus another.
Hmm.
So in California, I would say that most of the time, most of the assistants are medical assistants for most practices in general. But I know friends in like, New Jersey or New York, a lot of them may be RNs, that assist them.
Hmm.
So it really depends, I think, on your state. So I can't say that what I do is what everybody does. I
Right.
think it depends on the region in which you live and where you practice. But yeah, most of the people who work with us are medical assistants who assist me. We do have physician assistants here. We do have a nurse practitioner as well, and they are more providers. They do some of the services, like one is more cosmetically oriented, one does more general dermatology, one assists me in surgery. Um, but you can have RNs too that do the same sort of thing. I think in California, an RN or an LVN can do some services like I'm not sure if
In
they can. I
Hawaii, I
think
think
it's
they can do chemical peels.
yeah, so it's
They,
different in
yeah,
Hawaii.
but you
So
do have estheticians in your practice,
we do,
right?
yeah,
Okay.
yes, and that's more of a spa, like our esthetician side.
Okay.
Yes.
Okay. Now, in your history of dealing, extracting these cysts and surgery, has there ever been a moment where you're like, oh, I need just a break from this? Because I imagine that there's
Yeah,
probably some sort of odor that comes out
yeah,
or some,
yeah. I can't do cysts all day. I mean, I definitely. I mean, in all honesty, I would avoid them like most dermatologists before because they're not really something that you necessarily can bill for a lot of the times because sometimes it's considered cosmetic and it all depends on a person's insurance.
Hmm.
And they're messy and there's a high chance of recurrence really because if you leave any part of it there, it can come back. And so you don't really have much practice in it because you're usually trying to avoid it.
Hmm.
So, but now that I've sort of been forced in a way, like I'm doing a lot of them, I've become an expert at them, and I can kind of predict, how big of a deal one is going to be now because I've done so many of them now. And yeah, the ones that are sometimes it's unpredictable. You don't actually know all the time whether one's going to smell or not. The bigger it is, maybe the more chance it will.
Hmm.
It's a distinctive smell. It's not necessarily a terrible smell. We definitely wear masks, and that helps a lot. Um, and the most important thing is to be polite with those sorts of things.
Well,
If it
obviously.
really smells strongly, they probably can smell it too, and you just don't talk about it. I mean, it's not like it's not something that you can control. It's just imagine it's just skin that flakes off into this sac under the skin with the cyst. And so imagine the skin that's not washed, that's just been sitting in there getting a little wet, and that's what
Hmm.
it smells like. But skin that's been sitting around for a while. So that's the kind of smell that you'd have. It's not, but sometimes when something gets infected or gets inflamed, yeah, if
Yeah.
bacteria is involved, it can certainly have even stronger of an odor. That's usually when you'll call it an abscess. And that's usually liquid. And so, yeah, that can be smelly. But I've never said, no, I can't do this anymore. I mean, that's insulting to the patient. So
Hmm.
that would probably be the main reason why I wouldn't do that. But some of them are, I mean, the worst thing actually is, so I've been much better about protecting yourself because that have a splash guard, and you make
Hmm.
sure you do all the kind of precautions to not get sprayed because that's what actually ruins your day. When you get, especially when you have long hair, when you get it in your hair, it ruins your day. You want to take a shower, you always feel like you smell it, just like when you're at when someone has a fire at a fireplace and you can smell that, so you can
Yeah.
smell it in your hair. Every time you turn your head, you can smell it. It's that sort of thing. So it definitely makes you go home and take a shower. You just want to immediately do that. So yeah, we definitely do things. All my girls have been sprayed before. I all kind of know what it's like in some form or another. Not terrible. We've never, thank God, got it in our face or eye or our mouth or something like that. But you get it to the extent, and you know that smell that, yeah, that you want it off of you.
Part of the job.
Oh, yeah, it's just part of the job. Yeah.
So, a lot of the estheticians in the Estheticians Connect Facebook group wanted to know if you were ever going to consider doing any kind of course or training specifically for estheticians, what's in their scope of practice, what they're able
Mhm.
to extract, if that was something that you would ever consider doing
Sure.
or teaching or.
Sure, that would be fine. That would be great to do. The main thing I have about that is that the rules are different. So I would
Mm-hmm.
just need to do research on, I know that there's differences from state to state. You know more about this than I do. Some places you can't use a lancet, or you can't
Right.
use you can only use Q-tips, or you can only use tissue paper or gauze, and so you can't penetrate the skin. I think in California you can't pierce the skin technically.
Mm-hmm.
So, and a lot of that is there's a gray area too. So I certainly wouldn't want to do anything that to teach somebody something that was against the law for
Right.
them to
Obviously.
perform. But I know that some of it is interpreted loosely, from practice to practice too. So it's so that's the only difficulty I have with it. But other than that, yeah, I can show them what I do, and I think that's the one thing I fear more. I mean, I think it's great that estheticians, obviously, this is your job and this is what you're trained to do, but that's something that when I do this sort of thing, I'm not doing it to teach people what to do because I don't want a teenager at home to try to do this to themselves or to their friend
Obviously.
because you could cause more harm than good. Um, but yeah, that would be something fine if you wanted to help organize that. If somebody wanted to help put that together, that'd be fine. That'd be fun to do.
Cool. Well, I will
Okay.
propose the
Yeah.
idea, and
Yes.
I think that they'll all be thrilled. So
Okay.
perfect. Well, I thank you so, so much for your time. I know that everyone is just going to be so thrilled that you and so grateful that you took the time to answer their questions.
Oh, it's
And
really nice. I really find that I was telling you before we started this interview that estheticians are probably the core of the people who follow me, probably the biggest group of people. And I think I feel very fortunate that it's such a positive environment. I think everybody supports each other,
mhm,
especially on my YouTube channel. Like in general, people are really nice. There's not a lot of negativity there. And I think it's all a positive thing, but it's all to learn and to help people. And I think that that's why you guys are in your profession. And so I thank you guys. I think you're wonderful. I think the group of estheticians are wonderful, and they're a supportive group. And your group is obviously an example of this because you guys all get together and help each other out. So I hope we can all continue to do so. So thank you.
thank you. Thank you so much.